Welcome back, and thank you for staying with us on Daybreak Extra. So July, of course, marks a crucial time for women's health and is observed as a Fibroid Awareness Month. That is every July. Now, uterine fibroids, non-cancerous growth that develop in the uterus, affect millions of women worldwide, causing debilitating symptoms like heavy bleeding, pelvic pain, and pressure. And in some cases, we've seen women losing, pregnancies due to that. Recently, we saw a popular actress come out to talk about, her issues and how she has faced a fibroid. Even after operation, it still came back. So there is all that, sad situation going on. So as we shine a light on this often misunderstood condition, we aim to educate, support, and empower women to take control of their reproductive health. Joining us via Zoom from the State House is Dr. Agbor Ebuta, consultant family physician, vice president, medical initiative for Nigeria. Good morning, doctor. It's good to have you.
Good morning, Fatima. It's good to be here. And good morning, viewers.
Of course, it's good to have you, doctor. So let's talk about, first of all, what fibroid means, in details, and the type of fibroids for an average a Nigerian, say, man, woman, because some women do not even know what this fibroid entails until perhaps maybe after marriage or they've gotten to some certain age. So please explain to a layman what this disease is all about.
Okay, a fibroid, it's actually an abnormal growth in the womb. So every woman has a womb, and that womb is called the uterus. And that is where babies grow, well, most of the time. So the walls of the wombs are made up of muscles and fibrous tissue fiber. That muscle, on one or two occasions, on several occasions, some of the cells within that muscle may begin to grow in an abnormal manner, growing faster than the surrounding muscles, and then staying basically in one place and not spreading to any part of the body. So it forms a ball-like mass within the muscle tissue of the womb, and that is a fibroid. So a fibroid is just a mass of muscle and fibrous tissue that grows abnormally within the womb of a woman.
So how common are fibroids among women, and at what age does it, typically appear?
Well, generally speaking, fibroids typically present in women of childbearing age. And it is very, very common. Some studies do suggest that 1 in as much as 3 women will have fibroid. So if you look at the population of Nigeria, for example, where we have about 230 million Nigerians, you split that by 2, 115 million are female, and you split it by half, that is roughly about 55 or 57 million women of childbearing age in Nigeria. If you take about 30% of that number, you will be talking roughly about as much as 18, 19 million people, women, have fibroid in Nigeria. So fibroid is a very, very common condition. But a majority of the patients who have fibroids have no idea. They would complete their reproductive life, live up to 80, 70, and finally die without having knowledge of the presence of fibroids. So it's just a small fraction of people who have fibroids become aware that they do have fibroids and even present to the hospital. So fibroids are very common. 1 in every 3 women have fibroid, but most women will be unaware because of the absence of any symptoms.
Okay, I mean, doctor, thank you so much for that. You can see the picture displaying on the screen. You know, there are some people that don't really know that they have fibroid and it looks like they are pregnant. At what point should they, go to the hospital? Because a lot of them, you see them thinking it's pregnancy because, fibroid has a way that it moves in the tummy, and they believe that it's pregnancy. So at what point should they go to the hospital for a checkup?
Well, once you notice that there are abnormalities in the structure and the function of your body, you should get a consultation. When I talk of structure, you mean the appearance. If you are used to a certain appearance in your body, and there's a certain change in the shape of that part of your body, it's rational that you should get a medical check. If your body functions in a certain way and you have noticed that there's a change in that function, you should get a medical consultation. And I would expatiate on that. The reason why women with fibroid most times present in the hospital are a varied combination. For some reasons, some women may not have any symptom, but they would notice, as you pointed out, that their tummy seems to be getting bigger. Even when they have not had breakfast, lunch, or dinner, they notice that their tummy is bigger. Some people notice to a large extent that their waistline has increased and they now need to expand their clothes for whatever reason, even without adding weight. So it can be disfiguring to a large extent of the body shape and all of that. So if there's a change in that structure, some patients realize that, oh, I have a problem, and they go to the hospital. But more commonly, there is usually a change in the way the body functions. So we have talked about fibroid being a mass. Most times it's like a ball-like mass growing within the womb. Because the womb is located in the lower part of the abdomen and it is positioned closely to the bladder where we store urine temporarily before we find a place to urinate, and is also located close to other essential organs like the rectum where we store stool temporarily before we find a place to relieve it, and it can extend into the internal part of it can affect the function of the womb. It can present with multiple symptoms. If, for example, this mass of fibroid tissue is big enough to compress the urinary bladder, it means that the urinary bladder's volume is reduced. And once the urinary bladder volume is reduced, it means that once you produce a little urine, your bladder fills up and you feel like urinating and you have to go and relieve yourself. So some patients will present with what? Increased urinary frequency. And once you investigate, it's not about infection, or it's not about diabetes or one of the multiple possible causes of increased urinary frequency. You can just simply do a scan and you would find it there. Some people have had what you call constipation because the ball of mass within the uterine wall compresses the rectum. So stool does not come to pass freely as it used to. Other patients, like I have seen recently, is patients who have anemia. Now, one of the things that the fibroid can do is that because it is within the womb, it can expand the surface area. It can expand the volume of the womb, the internal part of the womb. And that means that higher levels and quantities of menstrual flow is accumulated. So patients would experience abnormal bleeding, excessive bleeding, for example. This excessive bleeding has commonly presented with anemia. Now, the funny thing about patients with a uterine fibroid that has caused a lot of bleeding and they have developed anemia is that it develops very slowly because they are losing blood every cycle. And this loss of blood, even if it's significant, they are able to compensate. So sometimes you would see in the clinic that a woman who has had a heavy menses for probably 4 years, 5 years, comes to the clinic, and one of the things you find out after running a few tests is that her blood level has dropped so much. Her iron store has also dropped. So these patients will present with chronic anemia, but they would not really feel the anemia, or the symptoms of the anemia may not be commensurate with the amount of blood loss because they've lost blood over time. And that is a very common presentation. In fact, I've seen a few patients in the last couple of weeks who present like that, and some of them had needed blood transfusion and others have needed just medications to build it up. In addition to that, uterine fibroids can also cause significant pain during menses. So it can cause a lot of dysmenorrhea, and you have patients needing to take medications during those periods. So uterine fibroids can present with multiple symptoms, and these are a few of the key and most common symptoms that would probe.
Okay, so doctor, I would like to ask this question. You talked about menses, the menstrual cycle, and the excessive bleeding. So, but how does fibroid affect menstrual cycle and fertility, especially for those that want to conceive? And there's the saying that the fibroid actually stops that from happening. So, how does that affect fertility and then the change in menstrual cycle?
Okay, so I will take first the change in menstrual cycle. The adjustments in menstrual cycle are typically a couple. Number one is that most times in some women, menstrual cycle is not associated with pain. But in a woman with fibroid, because of the abnormal contraction of the fibroid tissue and the change in function of the womb, they are more likely to have painful menstrual cycle. That's about pain. About the amount of menses, the amount of menstrual effluent, that quantity can increase. So it can lead to abnormalities in the quantity of blood loss during the menstrual cycle. That's number two. Number three is that it can also adjust the duration of the menses. So it can prolong menses, for example. So if you have a lady who has been menstruating for 5 times every 5 days in a cycle, she may now suddenly notice that she's now menstruating for 8 days and occasionally having intramenstrual bleeding because of the abnormalities and the impact of the uterine fibroid. So these are just a few of the impact that the fibroid can have just on the menstrual cycle. On fertility, well, there is a general belief, and there are studies that have suggested that although fibroids do not commonly in themselves cause infertility, they are highly associated the chances that you would find fibroid in women who have infertility issues, primary, secondary, or subfertility issues, is higher. And that is because, generally speaking, women who have not had high frequency of birth, who have very low frequency of birth, or who have not given birth at all and are in their reproductive age, have a higher chance of developing fibroids. The second issue again is that even when women get taken and get pregnant, if you have a fibroid that is within the uterine cavity, that is, the fibroid is within the womb, in the space where a child, the unborn child, should occupy, there's a chance that those kind of patients may have pregnancy losses to a large extent, because the internal structure and function of the uterus is going to be adjusted. So the uterine fibroid may affect issues like implantation and growth of the fetus. So that is the connection between fertility. So fibroids are associated, there are higher incidence of fibroids in women with infertility, either primary or secondary or subfertility, women who have a challenge with taking it. But I should add at this point that there are thousands and millions of women who have fibroid and will take in and deliver without any event. That is the more common scenario.
So, doctor, what are the long-term implications of a woman having fibroid in her, in future, if without just assuming she does not even know that she has this?
The most likely answer for that question is that there is no long-term implication in most women. Like I told you, we have drawn an estimate of about 15 to 18 million Nigerian women presently have fibroids. But I can tell you for free that a very small percentage of that number would present in the clinic. And they will present in the clinic for symptoms we have generally alluded to. In terms of long-term implications, once a woman with fibroid completes her menstrual journey and achieves menopause, because of the absence of the cyclical hormone, very precisely the hormone called estrogen, which is very essential for the growth of the fibroid, what would generally happen is that after menopause, at the cessation of the menstrual cycle, in the absence of estrogen, which is an essential component in the growth of the fibroid begins to shrink. So you would see scenarios that when patients present close to their menstrual cycle, maybe at the age of 45 and above, when they are nearing the completion of their menstrual cycle journey and they are coming to menopause, some doctors, depending on the severity of the symptom, may want to manage conservatively and say, you know what, you're going to be menopausal soon. Your body is going to stop producing estrogen, which is going to drive this process of fibroid growth and symptomatology. So we can as well just watch you, manage you conservatively, and it will start shrinking. But in women who develop, the second category is for women who develop fibroids early in life. Some women have had fibroids in their late 20s, in their early 30s. Women who do develop fibroids would now have a long-term period. They would probably, because if you are 20 years, if you are 30 years, and you're going to have menopause by 50 years, you probably have between 20 to 30 years of menstrual cycles, which during those periods, if you have a significant size fibroid, you would have symptoms. So the implication, the long-term implication for this patient is most significant. And I will take it one by one. For example, like I pointed out before, if you have 20 years of menses and you are losing blood over a long period of time, it is inevitable that you must, as a law, you are likely to develop iron deficiency anemia because of loss of iron, loss of blood, and all of that. Chronic anemia is associated with poor health, it's associated with lower levels of immunity, and is generally associated with poor quality of life. So the quality of life is affected. The second issue has to do with the pain associated with menstrual cycle. Although historically we've always not really considered the pain associated with menstrual cycle as significant. But I have come across patients, and there are studies to suggest and to demonstrate factually that there are patients with menstrual cycle who have their quality of life significantly impacted. Some patients with severe pain during menstrual cycle, sometimes driven by the presence of fibroids, are unable to function. They are completely grounded. If this happens over a long period of time, some of them are unable to keep a job, because if you, for example, every month during your menstrual cycle, you want to take a few days off, your employer may think that you are not a serious person. So this has implications for their social life. If they want to hang out with friends, it has implications. So there are long-term implications for people who develop fibroids at the early part of their life, because they have 20 to 30 years of experiencing these symptoms.
Okay, okay, Doctor. Let me
yes,
quickly ask this question. Before, if you wouldn't mind, I'll ask. There's a question from one of our viewers right now that would want to hear something about it. But then, before I take that question, is it genetic? Is it possible that history, background, family history can actually also lead for some people to inherit this fibroid? Because there's that misconception that people have, because there are certain things that is genetic, and there's a tendency that it could be passed to other generations. So is it possible for fibroid to be inherited by other people?
Absolutely. So studies have shown that in some families, there is a higher incidence of fibroid. That suggests that there is a genetic connection to fibroid incidence, and there is a lot of evidence to support that. However, we are not 100% sure about what exactly triggers the process, but we do know that high level exposure to high levels of estrogen, prolonged exposure to estrogen, and family history are critical factors in estimating the risk of a patient developing fibroids. Of course, if a patient has had a mother, a sister with fibroid, an auntie, a cousin with fibroid, a grandparent, a great-grandparent with fibroid, you would want to entertain a possibility that their risk is greater than the baseline of normal. The other issue, obviously, is that because of the presence of estrogen, I explained earlier, the importance of estrogen in fibroid formation. If a child, a female child, develops menarche, that starts her menstrual journey early in life, that chance is higher because the exposure to the chemical estrogen, which is critical, is there. And estrogen is not necessarily bad. Estrogen is important. Without estrogen, women will not be women. But
Doctor, sorry to cut you short. You said early when she starts her menstrual cycle early, at an early age. What age precisely? What age is it, from 9 to 10, or what age precisely is early?
Well, usually if you were to start menses by 9, 10, some patients would consider that early, because typically we see menses starting from the age of 12 all the way to 15. And if it is delayed beyond that, we are concerned.
All right, doctor, let's talk about this quickly. We have messages from our viewers. Perhaps we should take that first before.
Well, there's a message from one of our viewers, doctor, and the person said, I was diagnosed with HPB about 8 years ago, and I have been using the BP medicine, oftentimes up to date. However, I am hypoactive in an energetic, dancing joiners to gospel music and what have you. But the question is, what advice can you give, medical advice can you give the person?
Well, I'm a bit lost about the relationship with fibroid, but
yeah.
You said?
The message is displaying that I was diagnosed with HPB about 8 years ago,
and
I've
been BP.
Yes, so and I've been using the medicine.
This patient was diagnosed with high blood pressure.
Mm-hmm.
Well, high blood pressure is very common in Nigeria, and of course, it's even more common in the US. For comparative analysis, prevalence of high blood pressure in Nigeria is 30%. Meaning that we have 30 million Nigerians with hypertension. Now, hypertension is a very straightforward condition to manage because the blood pressure is consistently high, and all you need to do is, by whatever means, to maintain the blood pressure at the lower or controlled or normal range. Of course, using your medications and lifestyle changes are critical, and I would throw a light on that. Lifestyle changes would include daily exercise or frequent exercise, minimum of 30 minutes, low salt consumption, optimal weight for your height, reduction or modification of stress, avoidance of cigarette smoking, and a cut down in quantity or no alcohol at all. Apart from that, medication is critical and important, and medications need to be taken every day as prescribed by your doctor, because if you take your medications by 8 a.m. in the morning and they are daily medications, by 8 a.m. the next day, you have urinated most of it and you have to take it back. So even if your blood pressure has come to normal, you still need to take your medications, and under the direction of your doctor, it will be decided what will be done going forward. But there is some confusion about whether people should take their medications every day when their blood pressure has come down. No, you need to continue to do that, because that is the way to avoid the complications of hypertension. So lifestyle changes, exercise, low salt, diet modifications, optimal weight, no cigarettes, cut down alcohol or no alcohol, and use your medications.
All
Try
right.
to see your doctor at least every 2
your answer on
months.
that, doctor. Now, quickly, finally, let's talk about the prevention of or treatment of fibroid. Now, how can we treat? Is there any particular treatment for fibroid, and must it end with surgery?
It must not end with surgery. Only a small percentage of patients with fibroids will require surgery. Most patients will require no intervention. Because remember, we said that most people are even unaware that they have fibroids. The indication to intervene in patients with fibroids is only for fibroids that are causing symptoms. And again, if fibroids are causing symptoms, which may be size of the tummy of the patient, disfiguring, or other symptoms, as I mentioned earlier, the options are that you would consult with your gynecologist, and depending your age, your pregnancy potential, your plan for family, and other risk factors, a strategy will be decided. Now, the strategy for addressing fibroids are multiple. Surgery is just one of them. Other strategies may require some medications, which to a large extent adjust the size of the fibroid by reducing the production of estrogen that drives the process. So the fibroid starts to shrink. But these medications are very expensive, and when you stop using the medication, the fibroids begins to grow back.
Again.
That's number 2. Number 3 strategy is what you call interventional radiology. In this process, you try to use chemicals injected through the blood supply to the womb that will block the supply of blood to that fibroid. In the absence of that supply, the fibroid will begin to shrink. The 4th option would be the use of what you call the high intensity focused ultrasound. Now, that is a new technology that does where you go for several sessions and you use a high intensity ultrasound to storm the fibroid tissue, and over time the fibroid tissue will begin to degenerate, and that again can contribute. Yes.
Okay, doctor, I would have loved to ask another question, because there's a difference for people that don't really know, but I think because of time constraint, I may not be able to do that. If it is okay for you to join us again another time to talk about, the cyst, ovarian cyst, because it also makes people bleed, just like I think the fibroid, and there's a misconception about that too. But because of time constraint, we want to say thank you so much for joining us this morning to give us your own take on the Fibroid Awareness Month.
Thank you for having me. It's always a pleasure. And of course, yes, if you want to talk about ovarian cyst, I'll be available.
Right,
I would just want to add that there is a very small chance of fibroids progressing to cancer, but that chance is 1 in 10,000 and is more common in women who have had fibroid that continue to grow after menopause. So thank you.
Oh, okay. All right. Thank you so much. We'll definitely have you back again to, answer some of the questions for us. Thank you so much for your time.
You're welcome.
So we'll go on a quick break, and when we come back, we'll give you something, on the sports update this morning with our in-house analyst, Adeni Ajishafe. Stick around.